today we are going to learn about extremely useful life-saving emergency medication called Naloxone. So first of all, let's see when is Naloxone used. So Naloxone is a life-saving drug used during opioid overdose. So what are opioids? Opioids are a class of powerful, highly addictive drugs prescribed to treat or reduce pain, for example, pain after surgery. When used as directed by doctors, opioid medications safely help control pain. But if opioids are misused, they can create feelings of intense pleasure, also known as euphoria, and can lead to life-threatening overdose. So now, opioid drugs can be classified as legal or prescribed, such as oxycodone, fentanyl, morphine, etc. And on the other hand, illegal or street drugs like heroin. So overdose can happen with any of these drugs. Overdose means an excessive dose or consumption of drug which could become life-threatening. So now, Naloxone Free Kit is available to those people who are at the risk of an opioid overdose. They should always carry safely with them, or is available to a family member or friend that can help someone at risk of an opioid overdose. The Naloxone is available in two kinds. One is the Naloxone injection kit and the other is the Narcan, which is the brand name of Naloxone, Narcan nasal spray. So Naloxone injection kit is available in almost all pharmacies across Canada. So we do not need to provide ID. It is free to any member of public as part of the publicly funded community-based Naloxone program. So in this video, we are going to look at what a Naloxone injection kit contains. As you can see, I got this from Loblaw Pharmacy across Canada. So now let's open and see what a Naloxone injection kit contains. The take-home Naloxone kit contains 1. Rescue breathing mask. 2. A leaflet or a pamphlet on how to respond to opioid overdose step by step by administering the Naloxone injection. 3. 1 pair of rubber gloves. 4. 3 alcohol swabs, also known as alcohol pads. 5. 3 vials of Naloxone. Keep in mind each vial is 1 dose and each vial contains 1 ml of Naloxone. 6. 3 safety syringes with needles. First, look at the signs of opioid overdose, such as slow breathing or no breathing, unresponsive to voice or pain, pale face, lips or nails appear blue, gurgling or snoring sounds, choking or vomiting, cold and clammy skin, constricted or tiny pupils, seizure-like movement or rigid posture. If you see any of these signs, immediately call 911 for medical emergency. Because opioids affect the part of the brain that controls breathing, opioid overdose or excessive consumption of opioids can slow down or stop breathing, which can lead to unconsciousness and eventually death. Naloxone is a medicine that immediately reverses or treats an opioid overdose, but temporarily, and allows time for medical help to arrive. So how does Naloxone work? Naloxone is an opioid antagonist. This means that it attaches to opioid receptors and blocks the effects of opioids. Naloxone can quickly restore normal breathing to a person if the breathing has slowed or stopped because of an opioid overdose. However, Naloxone will not reverse overdoses caused by non-opioid drugs. Examples include alcohol, benzodiazepines, or cocaine. Hence, giving Naloxone to an unconscious person because of non-opioid overdose is unlikely to cause any harm. Thus, it is a relatively safe drug. So after calling 911, check whether they are breathing. See if chest is rising and falling. If they are not breathing and it is no, then start rescue breaths. And if they are breathing, it's yes, then put them in recovery position. Roll onto one side, hand supports head, wait for help to arrive and stop there. But if they are not breathing, then start giving them rescue breaths. For rescue breathing, read placement and use instructions on mask. Put mask on mouth, pinch nostrils, blow into mouth every 5 seconds for 2 minutes. If they are still not breathing, then make ready your naloxone kit. So now, I'm going to demonstrate how to administer naloxone injection intramuscularly. But before we start, a quick disclaimer. This video does not provide medical advice or tutorial. It is only intended for informational purposes only. Viewers are encouraged to confirm the information contained herein with professional medical sources. The very first thing you need to do is put on the gloves. Then, take out 1 vial of naloxone from the kit and pop off or take out the lid of the vial. Open the alcohol swab. Thoroughly clean the top of the vial with the alcohol swab. Place the vial on a flat surface and take 1 syringe from the kit. Remove the cap of the syringe, then holding the vial on a flat surface, insert the tip of the needle into the rubber stopper of the vial at 90 degrees. Keeping the vial upside down, slowly withdraw the contents of the vial by pulling the plunger down. If there are bubbles, then push the plunger up to slowly release any air bubbles. Keep in mind not to remove needle from the bottle while doing this, or else the medication inside will spill all over the place. Carefully take out the needle from the vial and gently flick the needle with your finger if there are even more little bubbles left. So according to the pamphlet, it says inject needle into the thigh, which is more preferable, or shoulder. Naloxone can be injected through clothing. Insert the needle at a 90-degree angle into the middle of the thigh. Here, I've taken orange to demonstrate it. And slowly press down the plunger and inject the contents of 1 dose until you hear a click. Now, when you hear a click, this means that the needle has retracted or drawn back. Safety syringe will usually pull back needle when plunger is fully depressed. So naloxone usually takes between 2 to 5 minutes to start working. Continue rescue breathing if the individual is still unresponsive, and then give the 2nd and 3rd dose of naloxone as needed. If the individual starts breathing, then put them in recovery position like this. So dispose of the used medication pieces along with the syringe into the sharps container if they have one, or return the pieces of the kit into the case itself. After they receive naloxone, they will experience withdrawal symptoms like headache, nausea, and vomiting, etc., which will eventually wear off. Let them know. Naloxone only works for 30 to 90 minutes, so wait with them until help arrives. Thanks for watching and see you next time.